Collecting a blood culture is an important medical investigation. After all, blood in a normal, healthy person should be sterile. The presence of bacteria in the blood indicates some illness. It indicates a bacteremia and possibly some more significant underlying disease. The training programme you're about to see is based upon the Saving Lives documents produced by the Department of Health and issued in June 2007. They set out the best practice for collecting blood cultures. Of course, it's important for the patient to make a diagnosis by taking the blood culture. Identifying the organisms and then identifying their antimicrobial susceptibility is essential for good medical treatment. But one of the problems is that we are collecting the blood through a potentially contaminated area, the patient's skin. So it's important that we do everything according to a strict protocol to reduce the risks of introducing any contaminants during that procedure, which would give a false positive result and wrongly indicate that a patient has an infection. This is important for the patient. It's also important for monitoring the statistics of the numbers of bacteremia cases, particularly those with MRSA, that there are in our patients in hospital. We must remember that collecting a blood culture is not a simple routine procedure that you do on every patient every day. There should be clinical indications for when you should take that blood culture, and that is the first decision that you have to take. Does the patient look or have some clinical indication that they're infected? Do they have a high temperature? Do they have rigors? Is their white cell high? What about their blood pressure? Could be falling if they're going into shock. Any of these indicate that there could be a significant bacteremia and therefore they require a blood culture. Once you've made that decision, then you go on and take it.
Gather all the materials required to take the blood culture before starting the procedure. Check the expiry date printed on blood culture bottles and the bottle sensors. Do not use any bottles that have expired or that have a yellow sensor. Following the Department of Health Saving Lives guidance, wash your hands thoroughly using soap and water before drying. Remove the protective plastic cap. At this point, the bottle septum will be clean but not sterile. Disinfect the septum using a 2% chlorhexidine in 70% isopropyl alcohol impregnated swab. Use a fresh swab for each bottle. Allow time for the disinfectant to fully evaporate in order to thoroughly cleanse the bottle septum. Confirm the patient's identity. If the arm is visibly soiled, clean with soap and water. Apply a disposable tourniquet and palpate to identify the vein. Cleanse the puncture site using a fresh 2% chlorhexidine in 70% isopropyl alcohol impregnated swab or similar device. The vein puncture site is not fully clean until the disinfectant has fully evaporated. In order to prevent contamination of the puncture site, do not palpate the vein again. Clean hands again, either by using soap and water or an alcohol gel. Apply clean examination gloves. It is not necessary to use sterile gloves. Carefully remove a winged blood collection set from its packaging and attach an adapter cap. Remove the protective sheath and carefully insert the needle into the prepared vein. Remember, do not repalpate the vein. Secure with tape if desired. To prevent air in the tubing from passing into the anaerobic bottle, place the adapter cap over the top of the aerobic blood culture bottle first. Push the cap down to pierce the septum. A vacuum will begin to draw the blood into the bottle. Hold the bottle upright and use the graduation lines to accurately gauge fill volume. Once the aerobic culture bottle has been filled to the required volume, Remove the adapter cap and place it over the anaerobic bottle. Repeat the procedure again using the graduation lines to accurately gauge fill volume. A 10 ml fill volume per adult culture bottle is recommended for optimal microbial recovery. A 4 ml sample volume is recommended when using paediatric culture bottles. Do not overfill bottles. The use of adapter caps without winged blood collection sets is not recommended. It is not possible to accurately gauge fill volume, and the potential exists for backflow of culture media into the patient. If additional blood tests are required, place an insert into the adapter cap. The insert guides blood tubes onto the needle. Fill the additional tubes according to their manufacturer's guidelines. In order to prevent the possibility of tube to blood culture bottle cross-contamination, always complete the blood culture first before commencing any additional blood tests. Remove the tourniquet and carefully remove the needle from the vein, activating any safety needle retraction device present. Discard the blood collection set into an appropriate sharps container and cover the puncture site with an appropriate dressing. Remove gloves and dispose appropriately before washing hands thoroughly with soap and water. Complete both the sample request form and patient notes recording the indication for culture, time, site of vein puncture and any complications. Ensure additional labels do not cover the barcodes on bottles and that tear-off barcode labels are not removed. In patients with suspected bacteremia, it is generally recommended that 2 to 3 sets of cultures are taken at separate times from separate sites.